Hey guys, I'm Siobhan, first year medical resident. I figured today we could talk about how doctors and nurses get along, specifically the things that doctors do that really annoy nurses. So it's really tough as residents because we just kind of parachute into these ICU teams which are really well formed. They all know each other well, they know how things work, and we just need to figure out how it goes on the fly really quickly. The reason that I think this is so important is because this is a team, and if we work better together, communicate better together, it should be better for patient care. So let's go figure this out. Okay, so number one pet peeve that doctors will do.
Not introducing yourself when you come into a patient's room. Like I was telling you before, there's a doctor that walked into my room this morning wearing a winter jacket, boots, no ID on him whatsoever, came up and started reaching for my chart instantly. And I was like, hi, sorry, like, why are you touching my chart? Who are you? Like, any indication.
Yeah.
Introduce yourself to the patient, to the nurse.
We can do that. We can do better at that.
Yep.
Respecting the nurse's workspace, because you do have your own personal workspace.
I was gonna also add, it's a shared workspace, but sometimes when you're thinking for a really long time, that space,
There's a lot of people.
yeah, there's a lot of people, and sometimes you just need we need that space because it's the only one we have.
Yeah, you guys
So
are
you're-
actually working on your
yeah.
computer and inputting.
So it's kind of like, can you take that stuff and get out?
Yeah.
I need to be there. But no, it's a shared space, obviously, and we
Yes.
all respect that for each other. I was just gonna say, pick up the phone. If it's ringing, pick it up.
Pick it up!
It's not my phone.
You mean like if it's the phone, even if someone isn't paging us back?
Yeah,
Any
wherever
phone,
you
any
are.
phone. If you're
The
walking
phone
down the
rings.
hall and the phone rings,
Just like,
you
Pick it up.
You're part of the team. Pick it up. Hello, ICU. Hang on, I'll get you somebody else.
Yeah, just pick
Pick
it
it
up.
up.
That's it.
Usually what happens is you're sitting in the workspace, you're taking up this workspace, and we're probably sitting there like, okay, well fine, I'll go do something. You come back, they're still there, and the phone's ringing, nobody's answering, but they're still on the workspace. Phone's still ringing. Pick it up.
that's amazing. Thank you. I will pick it up. I will pick it up. Wow, so this is actually very useful to hear all these things, just even as a reminder. So let's go see if there's some more nurses that have a minute to give us their feedback. So number one pet peeve, things that doctors do they just hate.
Okay, maybe not number one, but when residents or doctors just hop on your computer and look up all these different patients under your name,
Oh yeah.
which compromises my license. So
Oh.
thanks, guys.
Yeah, that's really bad. That's really bad. Yeah, so what would be number one piece of advice that you would give to residents?
Just I think communication is key. Communication, patient safety, respect for your colleagues, and don't think of yourself as we're in a hierarchy. Again, when I worked in the ward, there was definitely a hierarchy between physicians and nursing staff,
Oh,
whereas
okay.
it's kind of like, you're not my boss.
No.
We're meant
Yeah.
to work together, we're
Absolutely.
a team. We all, and I think some doctors forget that I'm here mainly as a patient advocate,
Yeah.
and I spend 12 hours a day with them. I
Yeah.
spend 12 hours a day with their families, whereas you guys, yes, you're highly intelligent, but you have numerous other patients to see. So just kind of taking into consideration what nursing staff and other members of allied health have to say. Or
So what would be your number one piece of advice for new residents like me?
Carry around an awareness of how immune to privacy, invading people's privacy, nudity, things that are just commonplace in the hospital. You know what, we're all guilty of it, walking through that curtain that's drawn because we're trying to address a patient issue. And patients and their families, nurses at the bedside, we really appreciate just like a quick hello from the other side of the curtain. Hey, it's Dr. So-and-so, do you mind if I come in?
I wouldn't walk up to your room and just
Just
walk
open
in
the door.
your bedroom door,
Yeah.
right? Like, that just
It's
seems,
the
what if you're
same.
changing or anything, right? You
Yeah.
just knock, it's the same
Yeah.
thing, right? All right, so pet peeve from doctors.
Well, one of my pet peeves that I have experienced is that the doctor will come in and do a procedure requiring, sterile towels and a dressing tray and lots of sharps and sutures and you know, they'll leave it all. They'll do the procedure and then they'll leave the nurse to clean up everything.
Yeah.
And I mean, really, they should take care of the sharps and ask, where can I put these things? I'd be glad to tell them.
Yeah,
So.
that's so incredibly reasonable and a good reminder. So.
Just being aware of everyone around that's participating in rounds. So
So not like doing this.
that's right. Don't turn your back to the nurse.
So as a nursing student then, are there things that doctors do that just really bother you?
As a nursing student, I wouldn't say I've had too many negative experiences yet. I would say a lot of them are positive. You guys are very informative and easy to talk to, so overall positive experience with residents.
Oh, that's awesome. We'll see, ask you in 5 years.
Yes, ask me again in 5 years. Sounds good.
Okay. Thank you so much to all the nurses who helped out with this film. It was fantastic, it was really fun, and it gave me a lot to sort of think about and good reminders. Don't forget to subscribe if you haven't already, and I will be chatting with you guys next week, so bye for now.